Thank you so much for tuning in. This is brought to you by CART Clinics. We try to take the average medical advice that most of us are getting and bring it to the best of what modern medical science has to offer. And the way that we do that is by conducting research that goes above and beyond and connecting with the best specialists in the world. This is all done by a team of doctors who truly care about you. We are bringing on new clients, a few every month. So if you're interested, just get in touch. Today, tuning in from Harvard Medical School and the Center for Advanced Head and Neck Cancers, we have Dr. Tom Roberts, an oncologist. Tom, thank you so much for being here.
Yeah, thanks for inviting me, Dr. Siddiqui.
Yeah, no problem. So to kick things off, I remember we talked at one point about how as physicians, we become sort of the de facto person who receives calls from our friends, family, people in a broader community. And I'm sure from the leadership role in a world-renowned cancer center that you're getting a lot of those calls.
Yeah, and unfortunately, it's I get a lot of those calls from family and friends. It's some variant of someone in my family or someone that I work with has a new diagnosis of cancer. Often it's a type of cancer that I don't treat, but it's usually people are reaching out because they just want to figure out how to navigate the cancer care system, which is incredibly complicated.
Are there patterns that you've kind of noticed start to develop for, opportunities people leave on the table or things that fall through the cracks in their cancer care that, of course, with cancer, there are some bad outcomes and sad things that happen that we have no control over. But I feel like in medicine, a lot of times people are getting bad outcomes that actually we do know what to do about, but the person was in the wrong place at the wrong time or they missed a certain step. So do you see any of those or some common themes come to mind?
Yeah, I think there's a couple things that come to mind when you ask that question. One is something that I tell my friends and family that reach out to me, and I tell my patients when I meet them, is that the most stressful part of a cancer journey is the days and weeks after you get the diagnosis, while you're trying to figure out what to do, who to see, what the prognosis is. There's so many unknowns, and oftentimes they're unknown because they just can't be answered yet. But in terms of the stress and anxiety, people are often able to get into a rhythm, and they're often able, once they get used to things, they kind of find a cadence that works for them to, I won't say it gets easier because treatment is very hard in different ways, but at least the cognitive burden of it sometimes decreases after people get going. A lot of the first few steps during that really uncertain, really stressful period is about finding the right team, the team that's going to be caring for you over the next months and hopefully years. And team here is, I think I define it really broadly. In terms when I'm usually talking to family and friends, I often end up being part of that team because they look to me to say, hey, what does this result mean? Hey, what does that mean? Like, what should I do about this? And then so I tell them an important part of their team is figuring out who are the doctors who are going to be treating them. Who's the medical oncologist that's going to be treating them. Medical oncologists are people who generally treat patients with chemotherapy or immunotherapy, systemic therapies that can be given via IV or pills. Do they need to see a radiation oncologist who's a doctor that treats cancer with radiation? Do they need to see a surgical oncologist, a doctor who treats cancer with surgery? Sometimes patients need to see all three of them. I would say most times it's a good time for patients to see all three of them at the time of initial diagnosis. Sometimes patients don't need to see all three of them. They only need to see one or two of those different specialists. And then in addition to the actual providers that are treating them, another really, really important part of who's on your treatment team is family and friends. It's really important for people to think not only about who's their medical team, but who's their entire kind of wraparound team to help them get through the process.
Yeah, that's such great advice. I feel like a lot of patients I see in the ER with cancer, they are getting advice or information at a time when they really can't absorb that information alone, and it sounds like a trivial job, but literally someone being there to, take note of the follow-up next steps, like what questions they need to ask, who they need to transmit that information to, what the patient needs to look out for when they get home. When you're overwhelmed with a new diagnosis or a new side effect, or, you just feel really crappy, it can be, incredibly hard to do that. And to your point, if you're someone who otherwise, always did that stuff by yourself, the patient themselves might not recognize that or be aware of that need until sort of they've already missed some things or, didn't keep track of stuff because they just weren't able to.
Yeah, I couldn't agree more with that. We in any visit, we cover an enormous amount of information. And especially at the initial visits, the time oftentimes when people see me for the first time, when maybe we're going over the diagnosis, the prognosis, talking about what else needs to be done in the workup. And then the second and third visits where we start transitioning to talking about treatment and side effects, and we're helping them navigate those first few weeks of treatment where there sometimes can be more side effects that we're working harder to manage. Having someone with you to, exactly as you said, take notes, to come with the list of questions that you want to ask ahead of time is extremely helpful. And a lot of our patients actually describe it sort of similar, like you said, they have a friend or they have a family member that they bring and they describe as their scribe. Just to write things down and remember, now in the modern era, you can actually pull your notes from clinic off of any EHR. So that does help some. I'm always surprised actually at the detail that some of my patients read my notes.
Yeah.
They'll ask me specific questions about specific lines, which is great. It's it's really good. They're using it as an opportunity to educate themselves, but the notes never capture all of the details of the conversation. And they often prompt more questions. So having someone with you to help remember as much as possible of that interaction, and sort of translating that into what it means for your life, right? Because we sort of, we know the right chemotherapy to give or the right immunotherapy to give at different times, radiation or surgery if it's needed. But the way that impacts every single person's life and the way that translates into their day-to-day is different, and it's challenging. And I can't guide everyone through all of that because I don't go home with them. Occasionally I talk to them on the phone when they're at home, but I don't see their house. I don't know what things look like there. Having people that are kind of grounded in both of those worlds are really helpful.
Like you said, you don't live with the patient, so there's just a limit to what the treating oncologist and their team can do. And I love that you're priming them for thinking about the infrastructure at home that is never going to be filled by even the world's best kind of medical system. We always tell our patients that they should think of the appointment as like 25% of the work, like the time in the office, and that 75% of the work is either before or after the appointment. Thinking of the list of questions that you're going to do, and then thinking of the logistical changes that you're going to make based on the counseling and advice, the new things that were surfaced in that visit, not just for oncology appointments, like for anything.
Yeah, absolutely. And it's an ongoing conversation as people, I would say, sort of uncover the layers of what different treatments involve. And it's often, like you said, in terms of recall, the first time someone hears something, they kind of understand 10%, both of the words that I'm saying and also like what it means for their lives. And then as they sort of go home and live their lives, that there's kind of new layers that they didn't think about and I didn't think about ahead of time that they have to figure out how to continually adapt to.
So we've talked about the team, and I want to double click a little bit more on some of those members of the team, because I think probably our listeners will want to know more about, who are the different experts within cancer and how do they know who they might need. Are there any other things that we can call it like the top 1%, the 1% of patients for whom you think they've really managed their cancer diagnosis and the whole journey in the best possible way? Like they've really availed themselves of the right opportunities and of the outcome that was possible for them, they got the best possible outcome. Are there other things that you have noticed that they do? I
think a lot of patients and their family members actually really truly become experts in their specific type of cancer. Sometimes, they learn so much about it that I feel like they could write the book on their type of cancer. Especially, I treat a lot of very rare cancers like salivary gland tumors, sinonasal tumors that, sometimes a few of the things that I treat, there's a few hundred cases a year in the entire country.
Wow.
And, within a few weeks or months of a diagnosis through various resources, patient advocacy groups, of which there are some really great ones for specific diseases, some online tools, and then online patient support groups. through using these different resources, some patients become incredibly well educated on their disease, and you can tell how well educated they become on the specifics because of the kind of questions they come with. One thing I will say that I think is really important on the topic of online resources is the importance of getting not believing everything you read on the internet. While there are some absolutely fantastic resources online, and I think there are some really, really, really great patient support groups, that have their own websites, that have Facebook groups that are very active. I've heard about ones specifically for ALK positive lung cancer, for example, EGFR positive lung cancer, adenoid cystic carcinoma, which is a type of salivary gland cancer that I treat. There are these really robust groups that help patients learn more, but there are also things out that are on the internet that are misleading, just wrong sometimes. And, sort of in the same vein that I have patients ask really great questions about what they should or shouldn't be doing in these nuances. I'll have people come in and will, have some information that is just completely incorrect. Like one thing that comes up really frequently is people ask if they should be cutting sugar out of their diet to treat the cancer. I guess this has propped up in multiple places online. And some people swear by it, but it's just factually incorrect for a lot of reasons that we don't need to go into today. And it's just sort of an example that there are great resources out there, but it's important to be discerning in the sources that you use.
Really well said. And I think that there's a lesson here that, a great doctor is never going to fault you for doing a reading and knowing your own process and wanting to be empowered about that. I can hear in your voice how much you appreciate actually patients who do that. But at the same time, a good doctor also has a professional obligation to be honest with you and give their professional opinion. And I think the patients that come in, equipped with information, but also wanting to learn and sort of ready to engage to see, what they read, how it squares with sort of a physician's take, are the ones who are going to probably triangulate the best information.
Extrapolating all the high quality information that's out there and applying it to the patient in front of you, because I think people, some of my really engaged patients, they'll go read research articles and they'll say, but this study said this study said this, and we have good conversations sometimes about why, yes, indeed, that study did say that, but it's not applicable to you for this reason. Especially in my field where, there are some areas of oncology where there are really large, really great randomized control trials that tell you exactly how you should treat condition X at time Y. Oftentimes in head and neck oncology, with the exception of a couple of the more common diseases that we treat, we're extrapolating data from retrospective studies, from studies that were done at one institution with a small number of patients.
Right.
And there's a lot more gray area that requires interpretation when you're actually treating the patient that's sitting in front of you. And sometimes, especially with the really rare conditions, there are things that people know from their experience that just aren't published.
What impact do you think self-awareness or sort of being able to place yourself on the bell curve in terms of conservatism or risk tolerance has on outcomes? People have very different feelings about how much of a risk they want to take with their cancer, going undetected versus how aggressive they want to be. And do you find that there's a certain kind of patient who has better results, like the person who knows themselves really well and is very assertive about that, the one who kind of listens and explores different opinions? We talked a little bit about second opinion services, and I'm curious who gets the most out of those.
There's risks and benefits with every treatment in oncology. And I think it's less about sort of your risk tolerance than it is about your preparedness for undergoing what you're about to undergo. There are times where the benefits far outweigh the risk. And someone can walk into my office and I should say, there's no doubt this is what you should do. It still comes with these risks, and it's very important that you understand them. But hundreds of patients have had this treatment. It was written about in this journal, and we know that this is the right thing to do to give you the best chance at having the best possible outcome with your type of cancer. It's important to understand the risks in those cases, but it's important to listen to expertise to help you discern some of that information. And I think kind of what you were saying about the patients that do the best, I think it's patients that really engage in shared decision making with their patients. With their providers. There are these times that it's really clear what people should be doing, and then there are times that it's less clear. And when you kind of talk about the risks benefits calculation that we're making in our heads and with people, I so often have conversations where I say these are the 2 treatment options, or these are the 3 treatment options based on the studies that were done in this type of cancer, or potentially even in another type of cancer. And it's hard for me to tell you which one is the best option here, because we just don't know. It's really, I think it's a really important part of my job to be honest with patients about the limitations of our knowledge about some of the types of cancer that we treat, so that we can engage them in those decisions. Because when there's not a clear right answer, I think patients' preferences really matter a lot in terms of thinking about how we should navigate some of these decisions. Second opinions. I think that's something that comes up a lot in oncology, and I think it's really, really important. And I recommend all of my patients that want to get a second opinion to get a second opinion, and I'm always happy to refer them to a specific person at a specific institution who I think is really good at treating the type of cancer that they have. And generally speaking, I get concerned if there's any oncologist out there that discourages a second opinion. My philosophy is the more, if you have a new cancer diagnosis, or if you have an established cancer diagnosis and you're figuring out the next step, the more people who are thinking about your case can only benefit you. There are limitations to that, right? I've seen patients who are seeing me for their 5th or 6th opinion, and at that point, you're at a point of diminishing returns. But having 2 or 3 people really conversing with each other and with you and trying to talk you through the different treatment options, I think is almost always a positive thing for patients.
So one is, be wary of physicians who don't want to entertain a second opinion. Another, I think, just by virtue of the example that you gave that I think is so wonderful, is you want your patients to know when there's uncertainty or when the data isn't clear. So I think that's actually another red flag, is if your oncologist isn't sort of helping you discern between the decisions that are no-brainers, that there's a really strong evidence base for, and then the ones that are really more of a judgment call. Are there any other kind of signals or signs when you're a patient with a new cancer diagnosis that should trigger you to think, I should expand my team, or this is a part of my team that maybe there's a deficit in? When do they know they should go to a referral center like yours?
Yeah, so I think 2 things. One is I'll say, I'm hesitant to say you should be wary of a doctor of an oncologist that discourages you from getting a second opinion, because I think there are situations where getting a second opinion is actually not appropriate or could be detrimental to you. And I think one that comes to mind immediately is something that requires emergent treatment. Like if you have a new diagnosis of leukemia, right, or if you have a rapidly growing oral cavity tumor, something that I see. It's not that I don't want you to get a second opinion. It's that you really need to start treatment now. Yeah, if a patient asks me, should I get a second opinion? I'll say not right now. You absolutely can after. So I would say if you're talking to someone who's discouraged you from getting a second opinion, I think just try to understand why, and hopefully there's a good reason why they're discouraging you from getting a second opinion, if there is any discouragement on that.
That's a great point.
Question is in terms of thinking about when to go to a referral center. And I'll say, just kind of taking a step back here, I'll use some language that we, at least as oncologists, use. We often in oncology, we talk about community oncologists or community cancer centers versus academic cancer centers. And often the biggest difference between those there's two big differences between them. One is at a community oncology site, often patients treat multiple types of cancers. They maybe don't treat every single type of cancer. Each individual oncologist there doesn't treat every single type of cancer that comes through the door, but maybe they treat lung cancers and gastrointestinal cancers and head and neck cancers, kind of a much broader portfolio than I treat, for example. Whereas at academic medical centers, you tend to have subspecialists or sub-subspecialists. So, for example, just going, in my practice, I only treat patients with head and neck cancers. Only patients with cancer in their mouth, their nose, their nasopharynx, which is behind the nose, or various parts of their throat or their thyroid. If someone walks through my door with breast cancer or with colorectal cancer, I say, you saw the wrong person. You got to go down the hall, because I don't see that regularly. I don't read the trials on that regularly, and I'm not the right person to treat it at all. And I think the big question, and one of the questions that I counsel friends and family on, is you want to be treated by someone who has seen your type of cancer previously, and you want to be treated by someone who has experience with the treatments you're going to receive, whether that's surgery, radiation, or systemic therapies. In terms of when we say being treated by it, I think it goes back to that question of who's your team. Because I have patients that come from very far away to see me and see members of my team, and they can't possibly come here with the frequency that's needed for their treatment. Sometimes the treatments that we give, they need to be given once a week, once every 2 weeks, once every 3 weeks, and you can't get on a plane and fly with that. I mean, technically you can, but it's challenging to get on a plane and fly with that frequency. And to be honest, it's hard for me to manage patients when they live that far away, because I don't know the people in the local hospitals. It's harder to have direct lines of communication with them. It's really helpful for people, even if I'm treating them, for having someone who lives closer to home to them to help co-manage it. So I have arrangements a lot of times with community oncologists where the patient will see me once every 3 months, and in between those 3 months, they're being treated by someone else who's applying the treatment that I discussed with the oncologist that lives closer to them, and we've decided is the best treatment plan for them. And I find those arrangements work really well when I'm part of the team, but I'm not the person managing the day-to-day, which makes some treatments much more accessible to patients.
That's great. Do you have any advice about experimental treatments, genetic sequencing, advanced testing folks can get, and how they know what is worthwhile pursuing?
Initially, when you asked about genetic testing, there's a lot of terms that we use for genetic testing, and for different types of testing about the details of your tumor. Sometimes people use molecular testing. Sometimes people use genomic testing. Sometimes they use genetic testing, NGS, whole exome sequencing. All these different terms come up, and they're all different kind of variations of the similar types of testing. They're essentially different ways to test for abnormalities in your tumor that may help inform prognosis and may help inform treatment options. So that's one of the things that I think you really benefit, especially for less common tumor types, that you really benefit from being seen at centers with subspecialty expertise, because they not only know how to interpret the information or have more experience interpreting it, but they also know what to send. Two of the sort of unsung heroes in cancer care are pathologists and radiologists, because without really world-class pathologists and radiologists, I can't do my job. The pathologists are often the ones that guide the additional molecular testing. They'll do additional stains and immunohistochemistry so that I know the right treatments to give patients. So I would say, at this point in 2024, virtually every patient with an advanced cancer should have some degree of molecular testing, and the exact molecular testing that you need depends on the tumor type.
Advanced meaning the stage of the cancer?
Yeah, so that's, I was sort of very careful with my word choice there. Because I do think that there are some really early stage cancers that you still don't actually need to do a lot of molecular testing, especially when they can be treated with surgery alone. There's really not a good indication to do a lot of additional molecular testing most of the time. There's no person, frankly, on this planet that can keep up with all of these changes in every type of cancer. And I think those are the kind of things that it's really helpful to see someone who has a lot of experience treating your type of cancer.
Do you recommend any way for patients to sort of save the pathology or the tissue so that if later on there is some need for that, it can be transmitted to a center, an academic center, or a more specialized group?
Yeah, so generally all that goes on in the background, and most, I hesitate to say all, but most, if not all, medical centers will save tissue for a period of time. Like we save tissue for years.
Mhm.
That's not, we maybe save it a little longer than most people, but I think it's pretty standard to save tissue for a while. And so when we see patients for second opinions, we'll usually actually request the leftover tissue or the slides that were reviewed at the outside hospital so that our pathologist can look at them again to see if they agree. And the other part of your question you're asking, I told you we were going to talk about it for an hour, is experimental therapies. One of the other hats that I wear is I'm one of the clinical trialists in our phase 1 clinical trial program here at MGH. So at any given time, we have more than 100 clinical trials for patients with different types of cancer, and at any given time, we have about 50, maybe a few more phase 1 clinical trials for patients with different types of cancer. Often the trials are applicable to multiple cancer types. And that's really a conversation that, again, I think demonstrates the benefit of subspecialty expertise, because your oncologist is going to be a person who helps you navigate that, frankly, really confusing landscape because it's constantly changing. One thing that I always tell patients is when they ask about experimental therapies and clinical trials, is that we will discuss it, but we'll discuss it when the time is right. Because if I was to go, a patient walks in my door tomorrow, and they want to know, they heard MGH has a lot of clinical trials and they want to hear about all the different options. I could tell them about all the options we have tomorrow, but if they don't need them tomorrow, it could be years or never before they need them. And what I tell patients is, I am certain the clinical trial options we have available 6 months from now will be different than they are now. And it's hard for me to predict exactly how they'll be different, but they will be different. So let's have that conversation about the options that are available at that time when we have to have that time.
Yeah.
Have that conversation.
Yeah. There's a real balance with cancer because there's such a long journey and there's so many important decisions to make, that you want to do research. You want to make sure that you're thorough and have opened a lot of doors, but you also don't want to open too many doors because then it can be basically sort of paradoxically worse care because you're not actually focusing on the actual most important tasks that you need to get done.
One is it's important to just sort of recognize where you are in your cancer treatment journey. We're grappling with different issues at different points in people's treatment journey, depending on the goal of the treatment, depending on the prior treatments they've had, depending on how healthy they are. And, the kind of conversations that we're having when someone walks through the door with a curable cancer, and the goal is cure and they're, young and otherwise healthy, are very different than the kinds of conversations that we're having with people when, they have incurable cancer. They're on their 3rd or 4th treatment for it, and the treatments are less and less likely to work and more toxic. And I think people always want to, I think it's often a really, and I think often valuable coping mechanism, kind of thinking that sort of diving in and finding that next treatment option that's going to change the course of the possibilities for a patient. It helps people focus on, give them hope. And I do think hope is super, super, super important. And one of the biggest challenges in my job is balancing hope with reality, because people can't get through the things we do to them without hope. But you also need to be very realistic about what's going on, even when things are not going well. Nuance and the importance of applicability to a specific patient, not even necessarily just a specific cancer type, but a specific patient. Working with your provider, your oncologist, to understand some of those nuances, I think is really important to make sure that you're getting the information that you need, and because you should really understand the goal of the treatment and the details of the treatment, but that you're not kind of getting lost in the complexity of everything else going on.
Now switching to more of a preventative lens, are there younger people are getting cancer than ever before, and all of us are trying to understand in kind of a dynamic, changing human environment what we can do to minimize our risk of cancer, minimize our kids, our loved ones' risk of cancer. What are kind of the forest, the high level things that you try to take on yourself?
Yeah, I'm just smiling because this is like an hour-long topic again. and it's
We'll
one
have
of,
to book another convo then. That's what we'll do.
yeah, and it's one of the most
That's
common.
great. That's a good that you have a long answer to this.
Yeah, it's one of the most common things that my friends that don't have cancer or don't have a family member with cancer reach out to me and ask about, because there's so much information and so many options out there, and there's going to be increasing options in the future about various cancer detection tools. As you know, like these multi-cancer blood tests that are coming out. There are these whole body MRIs that are coming out that are already available, and they all have risks and benefits. And I personally, my philosophy is I don't discourage or encourage any of them. I think my role, and I think any medical provider's role, should be helping patients understand the risks and benefits of them so that they can make an informed decision based on themselves. Because we just think it's really important that people understand the ins and outs and the pluses and minuses of any of these tools before they undergo them. Then the second part, I think the one other thing to your question I think is really important is people ask, like, what can I do to prevent getting cancer? And so don't smoke, wear sunscreen. Beyond that, there are these things that can kind of incrementally decrease your risk. And there's sort of varying degrees of data about, the kinds of diet you should or shouldn't eat, whether you should drink any alcohol, if how much you should drink, if you should drink any at all. Generally, I recommend people to eat a balanced diet, don't smoke, see your doctor regularly. If you've gotten a lot of sunburn when you were a kid, see your dermatologist regularly, and follow the advice of your primary care doctor. Because, in the same way that I'm up to date on the latest and greatest in head and neck oncology, primary care doctors are the ones that keep up to date on the latest and greatest in screening, and their job is to make sure that you're getting all the screening tests that you need.
That's great. What is something you're working on in your own health that you want to make better?
I'm trying to exercise more. I have, I have 2 young kids, and I have a very busy job, and I find that leaves very few waking hours when I'm able to prioritize my own physical fitness. I think it's, prior to kids, I used to run pretty much every day. It was really active. It's just harder to find the time to do that in an otherwise busy schedule, and it's always a balance to. It's always a balance because, like, in theory, I tell people, like, I could work 40 hours a day, much less 40 hours a week, and still have other things that I want to do, not things that I necessarily have to do, but want to do. And, there's only 24 hours a day. You need to be sleeping a few hours of them. And I could also spend many, many, many hours a day with my kids. So it's always a balance in trying to figure out how I get my priorities just right, so that somehow my physical health sort of squeezes in with my family and my work.
Yeah. Yep. I think probably a few people listening to this can relate to that.
Yeah. It's not a challenge that's unique to me at all, right? We're all still grappling with it at this point.
Yep. And it's a champagne problem to have so many wonderful things you're passionate about doing. So
yeah, it is. I couldn't agree more. It's my family fills me with joy. My work, I find very fulfilling, and anytime I can sort of squeeze in a few minutes in between them to get out on my running or on my bike is all good.
Yeah. Well, thank you so much for taking time out of the schedule to chat with us, and thank you for what you do. I'm sure I'll enjoy it.
Thanks for having me. I enjoyed the conversation, and I'm always available both to you, and if God forbid any people watching this have head and neck cancers, we have a really robust team that we're always here to help patients navigate the journey.